Feel nervous about bathing your baby? Be confident. Bath time can be a very enjoyable experience and the perfect opportunity for you to interact with your baby. Choose a bath time that suits you and your baby, preferably at the same time every day, so that your baby knows that it's a routine. Be well prepared and have faith in your baby handling skills. Approach your baby with tender, loving care so that she feels secure and confident in your love. Gather all the necessary things for you to bathe your baby so that it's easier and convenient for you to bathe the baby. Items to prepare. Example, number 1, a small bathtub. 2, at least 2 towels. Baby bath, shampoo or top to toe wash. Cotton wool in a bowl with cold boiled water for cleaning the baby's face. Alcohol swab for cleaning the baby's umbilical cord. A changing mat. A baby layered with clean diapers or nappy. Newborn baby lose sick very quickly, so the ideal place for you to bathe the baby is in the bedroom, away from the draft, to prevent your baby getting cold. However, if you need to bathe the baby in the bathroom, be sure that the floor is dry and safe to prevent slipping. Fill the bathtub up to 5 to 8 cm or deep enough to allow your baby to settle in the water with his shoulders well covered. For the safety purposes, fill up with cold water first, followed by hot water. Test the temperature with your elbow and make sure that the water is warm. The temperature felt by the hand may feel right to you, but may scald the delicate skin of the baby. Let's start with cleaning the face. Clean your baby's eyes with using cotton wool dipped in boiled cool water. Wipe his eyes from the inside corner to the outside. Use separate piece of cotton for the other eye. Next, clean the forehead, followed by the cheek, and finally the nose and the mouth. Always use a clean cotton for each area to prevent contamination. Hold his body under your arm and his head over the bath in one hand. Begin with washing your baby's hair and using the other hand to cup bath water gently onto her head. If you need to use a little shampoo to rinse her hair, ensure you use one that is gentle to baby's eyes and use circular movement. Immediately pat dry the hair to prevent baby getting cold. Put baby into the bath by supporting her head and shoulders with one arm and her legs and bottom with the other. Continue to support her head and shoulders with your arm while you use the other hand to gently splash water over her body. Wrap your baby in a towel and pat her dry all over, paying attention to the folds of her neck, cord area, bottoms, thighs and under her arms. Apply a mild and gentle moisturizer on her whole body immediately. Applying the moisturizer within minutes of taking your baby out of the tub will seal in the water that is still in her skin from the bath and keep the baby moisturized. Gently dress her up in clean nappy and clothes. To prevent infection and speed up healing, remember to clean the area every day with alcohol swab. If the top of the cord is wet, clean from the top downwards. If the base of the cord is wet, clean from the base upwards. Use a clean swab for each area. Turn the top of your baby's nappy down to keep the cord exposed to the air and clear of urine. Should there be any foul smell, please seek doctor's advice. Babies may have long nails at birth. Try not to trim at this early to prevent injury. Use mittens if the baby scratches her face. You may trim the nails after they have hardened a little, that is 2 weeks later. If the nails are long, you may trim it once a week, but do it carefully to prevent injury. Here are some points to remember when you bathe your baby. Never ever leave your baby unattended in the bath. Never put your baby into a bath when the water is still running. Make the family bathroom safe, put in a rubber bath mat, and cover the water taps. Do not allow your child to touch the water tap.